We're talking today to Dr. Virginia Clark, who's a hepatologist from Shands Hospital at the University of Florida. And so, Virginia, one of the first things we want to ask is, if you are dealing with a lung-affected alpha, what do you suggest to that person as a way of monitoring their liver health throughout their life in terms of what kinds of tests they should take and how frequently?
I think the recommendation that I have right now is that annual liver tests are the best thing that we have right now, probably the most accurate to detect liver disease for screening, meaning that you don't have symptoms, you're not having trouble, just with your regular annual physical that you should get liver tests checked. At the point that you are age 50 or so, that's when I would recommend that you get an ultrasound one time, and then if something is on the ultrasound, if there's some concern, you may look at the ultrasound again or have it done again in several years. Remember, liver disease takes several years to form or for it to develop, so the best way is the least invasive and the least expensive over a period of time. So I think liver tests once a year are okay.
Okay. And what do you advise alphas who do not have cirrhosis of the liver about what they should do in terms of thinking about alcohol consumption?
Oh, alcohol consumption. So that's a great question because everybody wants to know what is a safe level of alcohol consumption. And I will say in general terms, for any person who's not at risk for liver disease ordinarily, for women, it's 1 drink a day is what the recommended, no more than that. And for men, it's no more than 2 drinks a day. And that, when I say a drink, it means one 12-ounce beer or 1 4-ounce shot or 1 4-ounce glass of wine. That's how a drink is defined. For folks who have alpha, it's a little bit more challenging because there might be some increased risk for liver disease. It's been shown in some studies that alcohol is a risk and in some other studies not. So I think the bag, it's a mixed bag, and I would minimize intake. I'm not saying 0, it's hard to say that because the data doesn't really support it right now, but I think in general terms for your liver health, it's better. I will put a plug in for coffee, which I didn't mention, but coffee is very good for your liver. So drink 3 cups a day of coffee and limit your alcohol.
Does it matter if it's caffeinated or decaf?
It has to be caffeinated, yeah, actually. So you may be wired, but yeah, but coffee's good for you.
Okay. And the last question is, are there any drugs or over-the-counter medicines that alphas should avoid at all costs if they're not liver affected with cirrhosis, but specifically what comes to mind are things like acetaminophen, ibuprofen, and drugs for arthritis like Celebrex?
Well, I think the best thing for liver patients, I actually recommend my liver patients who have cirrhosis to take, if you have, I think there's 2 populations we should be clear about. If you have cirrhosis of the liver, acetaminophen is safe as long as you take up to 2 grams a day. So that means an extra strength pill is 500 milligrams. So that's no more than 4 of those in a 24-hour period, which is safe. I actually like that better than ibuprofen because the side effects of ibuprofen it can affect your kidneys and it can cause ulcers and bleeding. And I think for patients with cirrhosis, those are actually worse than any effects that a Tylenol would have. If you don't have cirrhosis of the liver, Tylenol is very safe in the recommended doses that are on the bottle. What you have to be careful of is that if you're taking Tylenol and medications that have a Tylenol plus some other medication, so you just have to be sure you know what you're taking. For example, a medication for pain might have a small amount of narcotic and a small amount of acetaminophen, and you don't want to combine that with additional Tylenol or acetaminophen to get too much. So that's where it becomes important to know. The Celebrex it's kind of a mixed issue, but I think it's okay. You just have to use it sparingly. In patients who need it, they need it and they get benefit, and we just follow liver tests.
Okay. Thank you so much for taking the time to talk to us.
You're very welcome.